Hello, my name's Fleur Nichols. I'm the medical esthetician here at Aurora. And I'm going to be talking to you about the recovery and results to expect from facial red vein treatment. Initially after the treatment, you will notice that the veins they're called blanched, so they have actually disappeared. So where you've cauterized it off, the blood doesn't flow through anymore, but you won't actually see the veins, which is quite appealing for all our patients. So you can actually see where the work has been done and the kind of results to expect. After a few days though, they will crust over. It's very minimal, it's like a scab, but it's a very small area, so something probably you will notice more than others, but certainly to yourself, visually they do look worse before they get better. After a few days, after about 4 to 5 days, these crusts will naturally fall off. It's very important not to actually pick them off. As anything with a scab, you can create scarring if that's picked off, so we suggest you look after the area. After 5 to 6 days, the crust will naturally fall off, and then the area will be fresh baby skin. We need to suggest again you use sunscreen on this area to protect it and not create any more red veins, and then you should start to see your result that way. Then we can assess the area and decide if any more treatment needs to be done. And do facial red veins come back? Well, if the cause is always going to be there and the skin isn't protected, then obviously there can be a reoccurrence, and sometimes they will find a way to reroute. But this can always be dealt with again. The full recovery period from treatment to end would be 2 weeks, and that is when we would perhaps assess the skin and decide if any more treatment would need to be done to clear the area, or if anything needs to be retreated. But generally, if it's a small area, we can treat all this in one session. To keep the results of your treatment, we really need to look at the causes, which will be done in your consultation, and then we really need to minimise the causes as much as we can. Aftercare after your treatment, we suggest to avoid the area for the first 24 hours, no cleansing, just to actually leave the area to allow it to naturally heal. You can use some antiseptic drying powder, but preferably we like to keep the area dry rather than wet, so not to apply any antiseptic creams. After that, gentle cleansing around the area, and obviously sunscreen applied. Once the crusts have fallen off, again, a sunscreen should be applied and you can go back to your general normal cleansing routines.